Dylan, yesterday we met for the first time and you were telling me about your product. This is your first time at this show, right?
My first time ever.
So why are you here? What are you promoting at the Ontario Together We Care trade show?
We've had a number of really exciting advancements in the platform by building AI, taking advantage of some of the new technology out there, really helping communities save time so the staff can spend more time with the residents. And we want to get that message out.
Okay. So do you have a booth here?
We do. We are at 1183.
Oh, wow. Okay. And how's the traffic been? Has it been good? Are you talking to a lot of people?
Traffic's been great. It got a slow start, and I think it's gone down a lull a little bit over the last hour or so as the sessions have picked up. But overall, I'd say this has been great.
Yeah. And so tell me about your product. Tell me what you guys do and how it benefits a home for them to use your product.
Yes, absolutely. So, categorically, we do resident engagement and we do staff operations. And the goal is to streamline workflows across the community, right? And every workflow that we can help make simpler and automate ultimately helps the community flourish by saving the staff time so they can spend more time with the residents. Building relationships is really, right, it's the passion that we're giving back to them. And it's providing a better experience for the residents.
So who's actually utilizing your platform? Like who's logging in every day? Is it the residents? Is it the employees? Like who's actually getting in there?
Our goal is to include everybody within the community and connect it to the community. And so the staff, of course, help coordinate the calendar and coordinate different activities, the virtual content. But the families also get involved. And so instead of having to call in or email, they have an app on their phone, the LifeLoop app on the family member's phone, where they get updates every day. And now the staff, instead of having to manage dozens of emails every day from the families, they get one blast, right, with all the information. We have smart editors so that we can configure newsletters and we can put together updates that are contextual, have information about each individual resident going out to the families, and they get notifications through the app. They can respond through the app.
Wow.
The whole hope is let's just get folks informed, stay in the loop, hence the name LifeLoop, and just bring these residents a fantastic experience.
So I imagine the onboarding process is probably pretty easy because it has to be easy for the residents, family members to use and so on. So what is that like? Like how do they get started when they first come onto the platform?
Yes, when they first come onto the platform, of course we set them up with the app. Now typically the staff members will interview the residents as part of the welcoming process to get to know them. It's so important to understand the unique likes, dislikes, interests of each resident, so that the programming can be tailored to them, right? Personalized to that resident. And so with the LifeLoop app, they hit record on a button, put their phone down and just talk to them, kind of like we're talking. Ask them questions, free-form interview. Our software then uses AI to generate the bio, to list out all the likes and dislikes.
Wow. So that seems pretty simple, and then anybody can get started pretty quickly in a typical home. So what is the size of the facility? Does it matter for you what your target audience is?
It doesn't matter. We have some communities who have less than 50 beds. We have some CCRCs in particular who have thousands of residents, and works for all shapes and sizes.
Yeah. Now, how long have you been with LifeLoop? Like, I heard you're pretty new to the company. Is that right?
I'm relatively new to the company. I've been with what was at one time called IN2L, or It's Never Too Late, which has been around for 25 years, right? So really one of the founders, right? They were the first company to bring computers into senior living.
Oh, wow. Wow.
I've been with the company for 4 years.
Oh, okay. So not that new. Yeah. And so what are you seeing as the biggest trends that are happening right now in technology that are changing your product and just the way people see products like yours or other products out there?
Absolutely. Why I think AI is a big one, generative AI in particular, thinking specifically about agentic AI and the ability to really simplify and automate workflows that would otherwise be incredibly time consuming, right? Where we have the goal of generating the entire activity calendar, which has been balanced to all the needs of each of the residents and optimized to the availability of the staff. Right? This is a very hard problem to solve with traditional programming approaches, but with AI, this is a solvable problem. So this is something we're pursuing. And then also value-based care, I think, is something that we're thinking a lot about. The system is broken, and that care, particularly in the United States, is so expensive. So finding ways to proactively engage the residents, addressing the social determinants of health early on, providing them more longevity, a better quality of life, less trips to the hospital. It benefits everybody.
That's amazing. I just had a conversation with somebody about robotics. Apparently, there's a robotics booth here, and they're actually putting people in for, not replacing, but in addition to nurses to care for the residents. And I can see something like your product interacting with those robotics in a very effective way, because you can have that information feed back and forth in different ways. And it's only going to lead to, AI making better decisions for the outcome of the resident.
Absolutely. I love that idea.
Yeah, it's incredible. I was blown away. I never really, you'd heard, there's robotics in the hotel industry where they're delivering your food to your room in certain hotels, but now they're bringing it here to healthcare. So that's great.
Yeah, it's incredible.
Yeah.
I'm going to have to check out that booth. That sounds really fun.
Yeah. Well, you know what? It's been great talking to you.
Likewise.
Let's do this again in long form. Let's find out more about LifeLoop. And where do people go to find out more about you?
Yes. Our website is great, lifeloop.com. Lots of information there. I can also offer folks that we have a few webinars coming up. Maybe I can share with you the information.
Yeah, absolutely. Yeah, we'll put it there on the link. We'll get people to click on it and go to your webinars once you give me that information.
Excellent.
So, all right.
Thanks very much.
Thank you very much.
Great to be here. Thanks a lot.